Good evening, everybody. This is Dr. Sangeeta Agrawal, gynecologist practicing in Prabhadevi, Mumbai, and I'm very delighted to join you today at 5 p.m. Today, I will continue on the subject of contraception and I will discuss intrauterine copper devices. So, what are these intrauterine copper devices? They are small devices made out of plastic. By and large, they are T-shaped. The vertical arm is stiff and the horizontal arm may be stiff or may be flexible. They have a copper wire which is bound on the vertical arm in some cases and in all three arms on some cases. The intrauterine copper devices are a form of temporary contraception and it is reversible, meaning that when you have contraception, when you use it and when you remove the device, then your fertility comes back. There are various intrauterine copper devices in the market and they last for either 3 years, 5 years or 10 years. You can choose which one you would like to put depending upon your choice, needs and requirements and your preference when you would have to, you are using it for spacing or you would want to continue it for long term as you finish childbearing. So you can discuss your need and then the doctor can advise you which one is best for you. They are very safe, very effective, 99% efficacy. So if I have to explain it in simpler terms, if 100 women are not using any contraception for one whole year, then at least 80 to 90% of them will get pregnant. Now, if the same 100 women are using intrauterine copper device for the whole year, then even less than one will get pregnant. And because it's difficult to understand how less than one, it's easier to explain that. If 100 women are using an intrauterine copper device for a period of 5 years, then only 1 or 2 patients will get pregnant. So, how does this device work? Now, this device has to be inserted into your uterus and it would require either a trained doctor or a trained medical personnel or a gynecologist to do it. And once it is inserted, the presence of that copper and in the uterus provides you the contraception. So how? Now, when the sperms come in contact with the copper, they cannot survive and therefore they lose their capability to fertilize an egg. If a sperm does manage to reach the ovum and fertilize it, and even if there is an embryo formed, then once the embryo comes into the uterine cavity, because of the presence of the copper and the device, it will not find place for implantation and therefore a pregnancy will not happen. Of course, in very, very rare cases, an accidental pregnancy in the tube can happen. So, who can use? Well, in my personal view, it is an ideal method for spacing here in India after the first pregnancy, but it can be used by those women who've never had a pregnancy, who cannot use, say, birth control pills, if that was an ideal option, but for some reason they cannot use birth control pills or hormonal injections. And it can be used by women who are HIV positive, and it can also be used by women who have finished childbearing but who would not want to do anything permanent. Who are the people who cannot use the intrauterine device? Well, those who have sexually transmitted infections, those who have undiagnosed vaginal bleeding, and those who may have certain problems with their uterus or cervix would not be able to use the intrauterine device. So whether you can use it or not is a discussion that you need to do with your gynecologist, who will take into consideration your medical, surgical, obstetric, and family history, and then decide whether which method of contraception is ideal for you. Of course, it will depend on your choices. So, what are the advantages? The intrauterine copper device is one of my most favorite methods of contraception. A, once it is inserted, it acts immediately. So, there is no waiting period. When you remove it, the fertility comes back in the same cycle, in the next cycle or the same cycle. It is absolutely safe in the breastfeeding and has no impact on your baby who's breastfeeding on you. It surely has no effect on weight, and therefore, one of the biggest fears which prevent women from taking birth control pills is that they will put on weight. Even though that is not true, but just in case it helps, then at least IUCD will not help you put on weight. So that is one big advantage. And of course, it does not cause any cancers, blood pressure, diabetes, etc. It's very important for you to remember that this device is just placed inside the uterus and it has no impact on your ovary. So it does not influence your hormonal cycle. All your hormones, all those which are made in the pituitary, all those which are made by the ovary, the estrogen, the progesterone, and the follicle, everything continues the way it should continue. And even the follicle is made. But the sheer presence of the loop prevents a pregnancy from happening. So it's common sense that the IUCD does not interfere with your periods. So when you have an IUCD put inside, you absolutely should mark your periods and be sure that you have got your period, and every time the periods are normal in flow and in quantity and duration. In case you miss your period, or in case you had a period which is not like your normal period, say for example you bled a lesser number of days or you had very scanty bleeding, then it is very important to report this to the doctor or the health worker and ensure that you're not pregnant. Now, so what is the risk? It can happen in very, very rare cases, but it is possible that during placement, the IUCD was not inserted well, or sometimes it has gone far too inside and therefore uh, perforated through the wall of the uterus, and there is occasionally a chance that it has been expelled out of your uterus into the cervix or the vagina. Under these circumstances, the uterine cavity becomes empty, there is no loop there, and an unwanted pregnancy can happen. In case you have such a situation, the doctor will then remove the loop if it's in the vagina or the cervix and then terminate the pregnancy. In a very unfortunate situation, if there is a perforation of the intrauterine device, then you will need certain investigations to find where it has gone and then a surgery, which may be hysteroscopic or laparoscopic, to remove the uh, IUCD. Sorry, but I don't have corona infection and there's nobody around me, so I should be fine. And all of you are safe because you're in the virtual world. I haven't sneezed on you. Well, excuse me for this. I'm coming back to IUCDs. So, what is the disadvantage with the IUCD? The disadvantage is that you need a doctor or a trained person to put it. And secondly, it um, it surely doesn't cause infections, but it does not protect you from infections. So if a woman is using just intrauterine devices for contraception, but if she has any fear of sexually transmitted infections, then she will have to tell her partner, or rather encourage him to use condoms. Now, when can we put the IUCD? It ideally can be put anytime in the entire cycle when you can be very sure that the patient is not pregnant. So, my personal favorite time, the best time to put it is just on the last day when the period is ending, finishing. So, if you bleed for about 5 days, then the fifth, sixth day is the best day to put in the IUCD. Why? Because whatever little extra bleeding may happen due to the process of insertion will also be covered up with the period, and your protection starts from right in beginning of the cycle, and we are also assured at that time that you are not pregnant. Nevertheless, if you come to me anytime up to the fifth day of your ovulation, and we would need to calculate when you ovulate, then we can put it up to that day. So let me explain better. In an ideal world, if the length of the cycle is 28 days, your ovulation happens on the 14th day. So I can put an intrauterine device up to the 19th day. And therefore, it can also be used as an emergency contraceptive up to this 19th day in those cases where you accidentally had sex and you were not prepared, and now you are in need of contraception. When you should remove? Well, you can remove it whenever you want. As soon if you should remove it when you are planning your next pregnancy, or when you have some problems which are not able to be resolved with routine care with the IUCD. When in the cycle, you can remove it again anytime, but my preference to remove the loop is just 1 or 2 days before the period is expected to come, or during the period, on the first day of the period, or on the last day, or 1 or 2 days just later after the period. Now, once you have the loop in place, it is perfectly okay to use tampons, menstrual cup, the disposable sanitary napkins, the reusable, washable cloth napkins, etc. Your choices for your menstrual hygiene do not change just because you have an intrauterine copper device. The only point you need to remember is that whilst removing the tampon and tugging on the thread of the tampon, you should not inadvertently remove the loop, though it's very unlikely to happen because the thread for the loop is much higher and the thread for the tampon which might just be at the introitus. Now, when should you come for a checkup with the loop? Well, the best time to do the checkup is after the next period, and then you can come once in a year or two, or follow a schedule for your routine gynecological examinations, and checking up on the loop can be done as a part of the same process. The good, the good news about the loop is that when you insert a loop after the age of 40, it does not matter whether you put a loop which was valid for 3 years, 5 years, or 10 years, because that same device is going to be perfectly okay for you right up to the age of menopause. So, you can continue the same device right up to menopause, and once you have stopped getting period for a continuous period of 1 whole year, then you can report back to the doctor and get the IUCD removed. Yes, I mean what I said. It is not going to do you any harm. Even if you have put in a 3-year IUCD at the age of 40 and you keep it till the age of menopause, which may be 50, 51, or 52 or whatever, it is not, that same loop will be effective. So you would not need to change a 3-year IUCD at the age of 44. How will the doctor remove the IUCD? Well, it's not painful. It's just a routine gynecological examination. They will insert a speculum and we just pull on the thread and it just takes a few seconds. How does one insert and is that painful? No. Even insertion is a very simple gynecological procedure done in the outpatient department. It does not need any anesthesia or analgesia. Vocal analgesia, a very considerate doctor is good enough. So we would expose the cervix, clean the vagina with a antiseptic solution such as betadine, and then we will insert the IUCD, which may just take a minute or so, and cut the thread, and we are done. So do not get scared. Feel free to have a discussion with your gynecologist and choose an intrauterine device either for spacing or once you finish childbearing right up to menopause to get your contraception. So there are a few questions here which I will address. There is somebody who had a miscarriage and after that has not yet got pregnant. Well, don't worry. You need to discuss with your gynecologist, do a whole lot of investigations on to why you had miscarriage. For example, is it because you have thyroid? Do you have a sugar issue? Are you overweight? Etc. And once you identify the cause, then you can treat that cause. If no cause has been identified and everything is fine with you and your husband, then there is absolutely no need to worry. I am sure you will conceive soon. Once you miss your period, see your gynecologist as soon as possible so they can start some medication for you, which will be supportive for the placentation. Somebody here wants to say that they want to conceive, but क्या पॉइंट ध्यान में रखना चाहिए? Well, most important is that whilst you're planning to conceive, you should see a gynecologist and do an entire preconception session and investigations. You should check your hemoglobin to ensure that you are not anemic. Check the levels of your vitamins to ensure that there is no deficiency. Make sure that your thyroid is normal, and if you have hypothyroidism, then you are taking the medicines and the thyroid levels are under control. Make sure you've taken all the necessary vaccinations such as hepatitis, rubella, and you should be taking folic acid. One tablet every day till the time you get pregnant and till the time you are 3 months pregnant, surely. Well, there are no more questions, I suppose. And I do invite all of you to have a good look at these videos. Feel free to ask questions relevant to the previous videos in your to us in the on Facebook, or you can communicate directly with me on the email ID. My website is www.gynecdoctor.com, which has a lot of information on health issues for women, and I invite you to have a look at that website whenever you have the time, and feel free to communicate by email or on WhatsApp with me. Till then, stay at home, enjoy your time at home with yourself and with your family. Good evening and goodbye. Thank you.